Hi.
Hi,
Hi. I'm Dr. Loza. Nice to meet you.
nice to meet you.
I'm just going to quickly wash my hands first.
Sure.
Okay. Can you confirm your name and date of birth for me?
Yes, Abby Hertz, and my birth date is 9/1/1984.
Okay. Nice to meet you.
Nice.
And how do you prefer to be addressed?
Oh, Abby is fine. Thank you.
Okay. All right. Sounds good, Abby. So, what's the reason for our visit today?
My belly really hurts.
I'm sorry to hear that. Can you tell me more?
Sure. I was feeling fine most of the day yesterday. I had like a little stomach pain last night, but I didn't really think much of it. I went to bed yesterday, and then this morning the pain has been getting worse, and now it's really bad.
I'm sorry to hear you're so uncomfortable. Where exactly is the pain?
It's like on my lower right side of my belly.
Okay. And on a scale of 1 to 10, how would you rate the pain?
It's pretty bad. I guess like a 9.
Okay. And how would you describe the pain?
It started off achy, but now it's really sharp.
Okay. And does the pain move anywhere?
No, not really.
Is it there all the time?
Yeah, it's constant.
Okay. And is there anything that you've noticed that makes the pain better or worse?
I guess it was pretty uncomfortable on the ride over here in the car. I also noticed that I had sex with my partner last night and I had some pain in my belly then too. Um, I mean, I guess for things that make it better, I've taken some Tylenol.
Okay. Did the Tylenol help?
A little bit, yeah.
Okay. How would you rate the pain after you took the Tylenol?
Um, Maybe like an 8 out of 10.
Okay. And are there any other symptoms that you've noticed?
I guess I am a little nauseated.
Any vomiting?
No, no vomiting.
Okay. And how's your appetite?
I I don't really have much of an appetite.
Any diarrhea or constipation? Any blood in your stools?
No, none of that.
Okay. And any pain when you urinate or blood in your urine?
No.
Okay. And how about fevers, chills, fatigue?
I feel a little tired, but otherwise no.
Okay. And tell me about your periods.
Oh, I don't get my periods anymore. I have an IUD. I mean, I guess they were pretty normal before that.
Okay. I'm going to ask you just a review of systems. So I'm just going to ask you a few different symptoms, and you can just say yes or no if you're having any of these things.
Sure.
Any weight changes,
No.
changes in your bowel habits,
No.
any joint pain,
No.
back pain,
No.
dizziness,
No.
visual changes.
No, I don't think so.
Okay. Um, and how's your mood overall?
Okay. I mean, worried about this, but fine otherwise.
Okay. And then in terms of medications, do you take any medications or supplements?
I mean, no prescriptions. I have the IUD. But nothing else besides that. I guess I'll take Tylenol every so often for just like aches and pains, but not regularly.
Okay. And do you have any allergies?
No.
Do you have any other medical problems, like anything a doctor has ever diagnosed you with in the past?
I did have an ovarian cyst on my left side a couple of years ago. I used to take birth control pills for that, but I don't anymore since I have the IUD.
Okay. And have you ever had any surgeries?
No.
Any medical problems in your family?
My dad has diabetes, but I think otherwise we're all healthy.
Okay. I'm going to ask you a few questions that are a little more personal and about your social and sexual history. I just want to reassure you that this information is confidential. Are you okay with this?
Yeah, of course. Thank you.
Okay. Do you smoke tobacco?
No.
And do you drink alcohol?
Yes.
Okay. How often would you say?
I mean, only on the weekends, maybe like one or two.
Okay. And any other drug use?
No.
Are you sexually active?
Yes.
With men, women, or both?
Men, just my long-term boyfriend.
All right. So now we're wrapping up the interview portion of our visit. Before we finish, what are you most concerned about with this pain?
I guess I'm just a little scared. I'm wondering if maybe it's another cyst, but it does feel different. I'm concerned, I don't know, that maybe it's something more serious.
Okay. So we've wrapped up the history portion. So now I'm going to move on to do the physical exam.
Okay.
First, I'm going to wash my hands.
Okay, thank you.
So first, I'd like to inspect the abdomen.
The abdomen is normal in appearance, no scars.
Next, I'm going to listen to your bowel sounds.
Bowel sounds are active.
Next, I'm going to press on the abdomen in 6 different places, first light and then more deeply.
The abdomen is soft. Ooh, it does hurt when you press over my lower right side.
Okay. Next, I'm going to perform something called the Robsing maneuver.
Ooh, that hurts.
Where does it hurt?
My lower right quadrant.
Okay. And next, I'm going to be performing the Psoas maneuver.
Ooh, that hurts too.
Where?
Also on my lower right side.
Okay. Next, I'd like to do a GU exam.
Oh, the nurse or someone already did that. They've left the results in here for you.
Oh, perfect. Thank you. Abby, thank you so much for your time. I'm going to go ahead and step out and speak with my attending, and we'll both be back in just a few minutes to discuss next steps.
Great, thank you so much.
Of course, it was nice to meet you.
You too.